everyone, my name is Ashley and currently I am a nurse in the cardiothoracic ICU at UPMC. We're going to be discussing membranoproliferative glomerulonephritis, which is a rare kidney disease that is often under-researched and underdiagnosed. So we're just going to be talking about its overall pathophysiology, the different medications that can be treated or help to treat this disease, as well as the holistic assessment that a nurse leader needs to have in order to adequately treat a patient diagnosed with MPGN. So overall, looking at membranoproliferative glomerulonephritis, we can call it MPGN for short. This is a rare kidney disease that is categorized by the proliferation of abnormal cells in the glomeruli of the kidney. So pretty much the proliferation of cells is caused by an abnormal autoimmune response that the body has. So this disease can either be idiopathic in nature or it can be secondary to an autoimmune disease such as lupus. So oftentimes it's idiopathic in nature. However, most times it has to deal with the patient's autoimmune system. So this proliferation damages the kidneys through structural changes, and the dense deposits of cells make it difficult for the glomeruli to filter the blood and toxins, to remove those toxins and waste, and form urine for the body to excrete. So that's kind of where the difficulty in this disease lies. A little bit about the pathophysiology. So we talked about this proliferation of abnormal cells. So the types of cells that we see in MPGN kidneys are mesangial and endothelial cells that deposit within the glomeruli. So you have a normal kidney, you have two normal kidneys. Pretty much their job is fluid and electrolyte control and removal of waste and toxins through the glomeruli, which are the little filters inside of the kidney. So that's how a normal kidney works. In a patient that is diagnosed with MPGN, once those cells proliferate, the glomeruli become occluded and the removal of waste becomes blocked and the kidney's functioning decreases. So with that, your glomerular filtration rate, which is the rate at which blood flows through the glomeruli per minute, is significantly affected. And as the GFR increases, the kidneys begin to fail. So another thing that's important to note in the pathophysiology of MPGN is that it is the result, or can be the result, of chronic antigenemia, which is constantly producing or overproducing antigens without having enough antibodies in the body. So the large amount of immune complexes disrupts the capillary blood flow that the kidneys have. So this makes it difficult for the kidney to properly filter the blood, thus the kidneys start to fail. Here on this slide, you can see, if you're looking at a kidney biopsy, the little purple dots, I don't know if you guys can see that, those are dense deposits of endothelial and mesangial cells within the glomeruli. Those are abnormal, and that's what blocks the glomeruli, and that's what makes your GFR increase and your kidney overall run into failure. So, in regard to demographics, according to the Kidney International Journal, MPGN unfortunately primarily affects adolescents and young adults that are Caucasian and male gender. In some cases, there have been diagnoses made where males are in their early 40s and they develop MPGN, but primarily it's in younger patients who are in their teenage years and early 20s. So now we're going to take a little bit of a look at a holistic approach to nursing care. If we look at the table shown to my right here, we can see that there are 8 different categories that work together to form a total holistic approach to being a nurse caring for a patient with membranoproliferative glomerulonephritis. So the first being the client needs and their values. What does the patient need from the nurse and the healthcare provider? What can they do to help better the diagnosis, the disease process, that's something that's really huge, and that's something that needs to be looked at as a nurse leader. There's also family dynamics. With MPGN, you think about the demographics. It's typically young males. So you have a male who's 17 years old diagnosed with MPGN. This is a life-changing disease. So their family dynamics are most likely going to be affected, as it's a hard diagnosis to take. The third category that we have listed for the holistic approach is the support system. So a patient, and I don't want to refer to a patient as just a patient, because a patient is a person, and that's the whole idea of the holistic assessment. But in regard to the patient that is diagnosed with this disease, they need a huge support system, because their life is going to change significantly. If it's going to be medications that they're started on, that's going to be a change for them that they're going to have to manage. If they need to go on to dialysis, whether it be hemodialysis or peritoneal dialysis, that's going to be a huge system change for them in their life. So those are some other things that need to be brought to a nurse leader's attention. The fourth category is the living situation of the patient. Oftentimes these patients require multiple hospitalizations for, if you have a potassium of 6.7 and need to go into an emergency room after dialysis. So it's usually, you want to be close to a hospital or some kind of medical center for, your living situation, but obviously that can't be the case for everybody. The fifth category of the holistic approach is the cognition and mental health. This is huge, especially for being a young person diagnosed with a pretty heavy disease. That can affect your mental health greatly, and it's something that I don't think we take seriously enough. I think there are a lot of risks for depression and anxiety related to hospitalization and sickness and missing out on things that most adolescents are doing. So that's also something that's very important. The other being functional abilities, the other category. There are going to be things that an adolescent can no longer do that they once were able to do once they get this disease. Whether it be sports or traveling, it's going to be limited, as most likely they're going to be dialysis dependent. So that's also going to make things hard. The seventh category is health issues. Now, sadly enough, MPGN is not a disease that's isolated to the kidneys. So though it is a kidney disease, it often affects multiple organs in the body, just because the kidney system is so vital and imperative to our body as a whole. So there are different health issues that can result from having this disease. The other and last approach to the holistic assessment is the financial position. This is primarily important when looking at transplantation for a patient with MPGN. There's a whole long process that patients need to go through in order to get approved to be put onto the transplant list, that being their financial position. Can they afford the transplant out of pocket? Does their insurance cover the necessary medications and treatments that need to be given prior to transplantation? So there's a whole slew of financial needs and assessments that need to be done. So here, if we look at this slide here, it's the diagram of a holistic care. Pretty much we need to, as nurse leaders, look at the person as a person and not necessarily as a diagnosis, as a disease, or even as a patient. So we need to look at the person's needs as an individual human being. 4 huge needs, we touched a little bit about them, are the physical needs, the intellectual needs, the emotional needs, and the spiritual needs. This is so so important, especially for patients who are so young and have such a horrible diagnosis at such a young age. It's so difficult for them to deal with. So if in any way we can ease any kind of stress that they're having in regard to the MPGN, that's something that we really need to think about, and as nurse leaders we can do. So now we're going to look at the holistic plan of care. So I kind of mapped it out in a way that we have an MPG and diagnosis. However, it's done in a timely manner based upon the lab values, creatinine, BUN, different patient symptoms. And it's done quickly so that treatment can be initiated rather quickly, as opposed to having a disease process start and progress to the point where it might not be, a patient might not be a transplant candidate, or they may not be able to live well on dialysis. So that's something that's huge. We need to holistically look at the patient, and we need to determine quicker what their symptoms are in regard to what the disease is that they may have. Another part of the plan of care is once their diagnosis is made, that they will be started on dialysis to ensure that there is adequate fluid removal and electrolyte equilibrium. This is huge because if you're not having electrolyte equilibrium, you might have a potassium of 6.5 and you might have a cardiac arrest. So that's something that as nurse leaders that needs to be in the back of our head in regard to how we plan our care. Another part of this in regard to dialysis is that since most people diagnosed with MPGN are at the adolescent age who are still in school, it's usually done so that they can do peritoneal dialysis at night for 12 hours. That way there's no limitation as to them proceeding with school. And I think that's something huge that needs to be taken accounted for. The other part of the plan of care is peer support through different social media or one-on-one therapy sessions. If the person feels that they need it with a licensed psychologist in regard to any anxiety or depression that they have with their diagnosis, it's really huge for them to be able to talk about it and have other people try to understand what's going on. The whole point of being a nurse is to care for a patient and to provide them with compassionate care. Now that, I'm talking about compassionate care and support with the patient and the family, it's supposed to be that the patient has extensive support through their transplant support groups to ease the stress of candidates if they are going to proceed down the route of transplantation. So they have a lot of support for patients who are pre and post in the transplant process. Usually with that process, I know UPMC has a pretty good organ procurement center, so they have a lot of coordinators who are given and assigned to a patient, and then the coordinator sticks with the patient throughout the whole process of being listed on the transplant list, receiving their transplant, and post-transplant. So that whole process, there's a supportive being that's with the patient and the family that whole time. So those are all some things that really need to be taken into account too in regard to the holistic plan of care. Okay, so we're going to talk about the pharmacotherapy. There are 3 common medication types that are used to try to treat MPGN. However, unfortunately, this is an incurable disease. So the first is immunosuppressants, second is corticosteroids, and the third is antihypertensive medications. So the steroids and the immunosuppressive drugs are used in people with MPGN due to their elevated immune response to the increased number of antigens that their body has. So pretty much we're trying to calm their autoimmune system down so that it doesn't attack all the healthy cells that the body has. This third type of medications used are antihypertensives. Basically, the renin-angiotensin system, which is the hormone system that controls regulation of blood pressure and fluid and electrolyte status, the heart is also at risk for damage when the kidneys are failing due to hypertension. So if you have a patient who is with MPGN, they're dialysis dependent, and let's say their dialysis is not working well anymore, they're going to have fluid buildup, electrolyte imbalance, and that's going to result them to have heart failure due to their increased blood pressure, which would be indicated with the fluid overload that they would have. So unfortunately, these patients that have fluid overload, that need to take antihypertensives, they're also at risk for a myocardial infarction and stroke, which then furthers their diagnosis, as then they are indicated for more surgeries. And there have been patients in the past with MPGN who are young and require a coronary artery bypass graft surgery due to their increased blood pressure. Okay, so some considerations for nurses to kind of know about these medications. With immunosuppression drugs, you're obviously going to be at risk for infection because your body's autoimmune system is compromised. This is also going to cause you to have potential skin breakdown that could cause sepsis. It's really important to monitor a patient's CBC and differential. That way you're knowing whether their white count is up, elevated, down. You can kind of trend those different levels. With corticosteroids, the big thing is gastrointestinal bleeding to be aware of. The patient will need to have some sort of diet modifications, as they're also going to most likely experience hyperglycemia. With antihypertensives, patients can have tachycardia as a result of being put on an antihypertensive. They can have postural hypotension. It's also good to consider when giving a patient a medication that is an antihypertensive that beta blockers and ACE inhibitors are primarily more effective on Caucasians as opposed to African Americans. On the other side, calcium channel blockers and diuretics are more effective on African American patients as they are Caucasians. Okay, with transplantation, this is pretty much the end goal for a patient diagnosed with MPGN. The idea here is, though this is an autoimmune disease that cannot be cured, the ideal situation would be that the patient would receive a transplant from either a deceased or a living donor, and that their end-stage renal disease would be uplifted and they would no longer require to be on hemodialysis or peritoneal dialysis, as the kidney transplant has been successful. Unfortunately, MPGN recurrence and allograft failure is the result of nearly 14 and a half of the transplants done in order to treat MPGN. That's according to the American Journal of Kidney Diseases. This disease and diagnosis has a significantly negative impact on the survival of the allograft as compared to other forms of glomerulonephritis. So that's something really big. And another reason why it really needs to be a disease that is studied more. Next, we're going to talk, and lastly, we're going to talk about the recommendations for nurse leaders. I think the biggest recommendation is that it is so hard to diagnose MPGN because the symptoms that are associated with are so vague, and they're also associated with so many other diseases that it's really hard for healthcare providers to pinpoint exactly what the patient has when they're having symptoms. So the symptoms that are associated with MPGN include consistent edema, decreased urine output, hematuria, bronchitis that's persistent, proteinuria, as well as dysmorphic red blood cells. So though these symptoms are seen in many different disease processes, I think my biggest recommendation is that when you have a patient come in, let's just say they come in for chronic bronchitis and they're 17 years old, there obviously is a reason for their chronic bronchitis, no matter how many times you're treating them with antibiotics or steroids. If they keep recurring and having recurrence of symptoms, I think the most important thing would to do a renal biopsy to see if the patient does indeed have MPGN. Though it's an invasive procedure, you can get a quick diagnosis and treatment can be started so that your disease isn't progressed to where it's out of control and you're not going to be able to control it because you're also affecting the other organ processes of the body. So altogether, MPGN is such an under-researched disease that has really detrimental effects to those who are victim to it. As nurse leaders, it's really our job to want to do research, to study, to guide patients to better care and compassionate care. That is what our job is. Our title as a nurse is to care for others. So as more research is done, as advancements in technology and medicine are made, I hope that we're going to be able to better diagnose patients with this disease and we can better their quality of life and uplift their spirits. This is something that I really hope in my lifetime that we are able to do. Thank you everybody for listening. I really appreciate it.